Sometimes, the baby is in an awkward position. I think the one thing is obviously the Doppler, because the guideline is what guideline. We must be doing a color Doppler. So I would never look at the heart without looking at the Doppler as well. Always, always. So here we are. So we'll go back again. So you can see if we're starting from the abdomen, you're going up. There's a 4-chamber view. Is that normal or abnormal? Okay. I don't think anybody would say that this is normal. Why? Well, I'm not really able to see two nice ventricles. What I'm seeing is that the one ventricle, the wall is very thickened, hypertrophied almost, and I can see one dominant ventricle, which appears to be on the left-hand side. And there is also a large VSD, which will be better demonstrated if you have the color Doppler on. So, and therefore one ventricle, really small, very thick wall, and large VSD, and the left ventricle, which is a bit bigger. So normal, abnormal, very easy. That's abnormal, correct? So what's the abnormality? Well, let's go. 97% of you said abnormal. Fantastic, makes sense. So let's go at the list of the differential diagnoses, because obviously you don't have everything. You don't have the color, you're not scanning yourself, so it's a bit tricky. But let's look at the differential diagnosis. You've got bimanual artesia with intact ventricular septum. No, that's not. You've got tricuspid atresia with VSD. Yes, that makes sense, is it? Because I've seen large VSD, I've seen the right ventricle, which is really small and hypertrophied because of the tricuspid atresia. So in cases of tricuspid atresia, of course, you're relying on the fact that you have this large VSD for the blood to go across from the from the left to the right, and from the right ventricle to the pulmonary artery. You hope that there's no pulmonary atresia, for example. And therefore, this is a case of tricuspid atresia with VSD. It's not a tricuspid valve dysplasia, because otherwise you would have been seen sort of similar, maybe to a little bit of Epstein. And also, I've not shown you mitral atresia. Okay, so the correct diagnosis, which actually 44% of you got it right, is a tricuspid atresia with VSD. Okay, any comment?
What is typical of these anomalies that you see really that the tricuspid valve is replaced by a white stripe of tissue that is not opening. So we saw that there was only one valve opening and the other one is in actual fact completely blocked and atretic. And so I think that's the combination of a large VSD with a small right ventricle and with this white band tissue, there where you would expect the tricuspid valve is quite suggestive of this diagnosis.